Phase 1 of the $125 million state-of-the-art Providenciales Hospital is complete, but Phase 2, which calls for recruiting, staffing, equipment, and certification, is months away from being finalized, says officials of InterHealth Canada during a handover ceremony and a multi-agency tour this morning. And though the infrastructure is not fully equipped, CEO of InterHealth Canada, Roger Chessman, tells News 4 that they are weeks ahead of schedule and will be ready for their 2010 operational date.
You can see that the building is largely without equipment at the moment. So all the equipment is on site. It's in various parts of this compound. In January, we have large teams of people coming in. They will be installing all the equipment. So by the end of January, a similar tour of this building will be very, very difficult, and things will be far more obvious. There'll be beds in the ward, there'll be the operating tables in position, the anesthesia machines, all of the physiotherapy machines.
The intricate public-private partnership between InterHealth Canada and TCIG calls for additional beds to be installed to the 40-bed facility over the remaining 23-year period on the basis of growth of the TCI population. Chessman confirms that training, staffing, and in-house patients at the already existing hospitals of Providenciales and Grand Turk will be transferred to the new facilities once certification has been given by a private regulations board.
From that point onwards, we begin to prepare the centre for patients. We do all the testing with our staff on the equipment so that we can sign off on it. Then we have the issues of training staff coming in on that equipment. So we will have key people coming in throughout February and March. They will learn the new equipment and they will train others as they come on board. We've already started our training programs. People from Myrtle Rigby Hospital and the Grand Turk Hospital are going through a major orientation program with our people at the moment. I believe that we have something like 70 or 80 people who have already been through the program, and that will accelerate as we go into the new year.
Ex officio member of the National Health Insurance Plan and Director of Medical Services, Dr. Rufus Ewing, says the handover represents a milestone in healthcare for citizens of the Turks and Caicos Islands.
This hospital is quite impressive. From the outside it may look small to a lot of people, but it has in it all of the components that makes it a hospital, and not only a hospital, but one that I can definitely see from an infrastructure and technology standpoint, the best little hospital in the Caribbean region. Well, I'm sure everyone who have the opportunity to come here and come through these doors will be convinced that the money that they put into national health insurance that deals with providing healthcare in Turks and Caicos will be put to good use, and has been put to good use, and will go a long way in delivering quality care to them and their families here.
The National Health Insurance Plan was also partially established to foot the whopping $5 million per month bill that the new modern hospitals will cost. Nearly 20,000 workers, including the self-employed, have been enrolled in the plan, and contributions began from November 1st through December 14th to collect some financial reserves before the hospitals open in April of 2010. For WIV4 News, I'm Angie Toussaint.